Dr. Kapur, that's ready whenever you want.
Okay. Start, are you highlighting me?
Yeah, you are highlighted already. I've done that.
Okay, lovely.
Om, everybody.
Om. Om.
Let me mute everybody as well. Sorry, I haven't muted everybody. Give me a second.
Oh, I am not coming up. Highlight it.
We can see you, Doctor.
Can't see.
And you see me now?
No, no.
No?
No.
Now? No.
No.
We can see you. We can see you.
Okay.
And I
Now,
can see
you have to highlight me. I think it's not coming on spotlight.
We are not.
Okay, never mind. You can see me, small one. Namaskar. Good morning. Not a bad morning in London. Still cloudy. And today is what day? Friday. Jai Santoshi Mata. Jai Santoshi Mata. Jai Santoshi Mata. That's it straight. Keep the neck straight, spine straight, shoulder behind. मन सहज आंखें बंद. ध्यान मुद्रा में बैठ के लंबा गहरा सांस लेंगे. नाक से और मुंह से 3 बार पवित्र नाम का उच्चारण करेंगे. ओ ओम भूर्भुवः स्वः तत्सवितुर्वरेण्यं भर्गो देवस्य धीमहि धियो यो नाम प्रचोदयात्. ॐ सर्वे भवन्तु सुखिनः. सर्वे सन्तु निरामयाः. सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःख भाग् भवेत्. ॐ शान्ति शान्ति शान्ति. Let's all pray to Almighty for the wellness of whole universe. Everybody should be healthy, wealthy, enjoy prosperity. Nobody should suffer from any ailment, whether that is physical, mental, spiritual, social, emotional, or financial. With these good thoughts, we'll start our session, keeping in mind all the precautions. We know yoga practice, what have been advocated by our Swamiji Maharaj, is very, very simple. But even then, we have to keep in mind certain precautions. Always follow your body. Do as much your body allows you. Suffering from hypertension, heart problem, severe acidity, severe asthma, severe backache, or you are recovering from any ailment, please do it very, very slowly. That goes to all your yoga poses, physical exercise, and even for pranayama. That's why we say there are 3 speeds. Gentle speed, that is slow speed. medium speed, and the fast speed. But on the Zoom, I humbly request you, don't go fast on the Zoom, please. Thank you. This is very, very important. Now we want to activate ourselves before we start our topic of, what is that? Memory loss,
Yeah.
which is so common. Most of us suffering from time to time from memory loss. And I would
Memory
love
loss.
to know how many people have this problem. Thank you very much who asked for this topic, because that is very applicable to our age also. In this golden age, we are forgetting so many things. Never mind. We will first lift up ourselves so that our attention is increased to listen to the whole topic. Start with gentle exercises. So easy, so easy. Just raise your arms up and down. Up and down. Up and down. Where am I gone? I can't see myself. Where am I? Sideways. Now go sideways.
We can't see you properly. You have to.
Yeah, I don't know how to do it. I'm not a
Only
host,
your-
you know.
No, your camera is focusing ceiling. You come down slightly.
Ceiling.
That's it. Bit more down. No,
Now?
so too far down now. Too far
Where is the
down.
camera now?
Sorry, too far down. You need to go up.
I don't know what's happening.
That's it. I can see you now. That's better.
Now,
That's right.
okay.
Yeah, I can see you
Now,
now.
okay. Now you can spotlight me, I think.
You are spotlighted.
Sideways now. Take it up again. Stretch, stretch. Then go down slowly. Very slowly. Follow your own body. Enjoy every step. Every step. Go up again slowly. Here you are doing your Bhastrika Pranayama. Going down, you are breathing out. Coming up, you are breathing in. Stretch. Then go on the side again. Slowly. At the shoulder level, hold it there. Increasing the circulation in most of the parts of the body. Very good. Take it down slowly. Now, breathe in again. Go down slowly towards the ground. Keep in mind the precautions. Backache, high blood pressure, low blood pressure, osteoporosis. But this is very good for my memory. Increasing the circulation of blood in my brain. Hold it there. That will increase my concentration. And come up slowly. Up again, stretch. Hold it. Stretch. And bring the arms by the side slowly, very slowly. I'm not going to spend a lot of time on this because we have to cover all this later on. Now, to make ourselves active very easily and quickly, go on clapping. Very good. Very good. Very good. Next. Come here. This is our topic today, the brain. Increasing the circulation on the brain by tapping. This take away all my stress, my anxiety, my depression, my dementia even. Carry on with a smile. Laughter. Increase my memory. Very good. Very good. Then you can come down to here, the crease at the elbow. This is a very quick way to get activated. In the morning when we get up, you want to leave, don't want to leave the bed, but we have to get up. So do this in the bed when you get up early morning. You're so active, simple. Carry on. The hair, on, axilla. Good for the lymphatics also. Very good. And you can go on doing this side by side. Other one. Then you can do your neck also. Come on, down, down, coming down, down. And we are doing the whole body. Quite active now? Yeah. Give a smile. If you are active, give a smile now. Because we have to concentrate on the topic now. I did say last week, I would love to know how many people are having these problems. And I will give you a short time in the end to say about yourself. What type of loss you are having in your memory. Well done. That's enough. I think time doesn't permit to do more. Memory loss is such a common problem. It happens with us on and off. But it depends how bad is that. How often you're having this. How much this is affecting your daily life. That is very important. Memory is just collection of your things in your brain. Like computer, you know, things are put in down there. And we call it two types of memory. Like short-term memory and long-term memory. The short-term is when I have met some friends, new friends. They gave me a phone number or their name and I can't remember. That is short. And other long-term is the long things. Like you don't remember your relatives, your husband or wife, and they get confused. The children, the grandchildren, that is long-term type, you know. And so many things come under that heading. But simply to say short-term memory and long-term memory. Now this is affecting many people. And please don't ignore. And on the other side, don't diagnose yourself. There's so much panic about dementia. So people are thinking if they are having memory loss for short time, even they are saying, doctor, maybe I'm suffering from dementia. Please don't diagnose yourself. Dementia is quite late stage of loss of memory. And there are so many other points involved in that. So never diagnose yourself. Ask your GP if you or your relatives are concerned about your memory loss. They can go and consult the GP and the GP will refer to the memory clinic. These are the special clinics where they do very intensive investigation. They ask you many questions. They make sure your thinking power, your memory, and then it can be diagnosed or they might say it's nothing serious. Just change your lifestyle a little bit and various other things which we are going to talk about. What are the things you can do yourself if you are having memory loss? And you know, if it is very serious, then GP send you for scan, MRI, CT scan and whatnot to make sure there is no problem here. Because there are so many causes of memory loss. The first and the foremost is getting on old. Like we're getting other diseases, you know, so many problems we are having when we are getting on old. So this is natural process of getting older. Then other one is if you're a very stressed person, always stress, anxiety, depression, because this brain is cluttered with so many thoughts here that you can't remember what you want to remember. So depression. Then other one which is very important is sleep disturbance. If you are not sleeping adequate, then you will get memory loss. We all know that. We feel very tired, very edgy, very anxious when we are not sleeping. And they have done a lot of work in America. They have done about 88,000 people who were sleeping less than 6 hours. And then they all landed into dementia. But again, here we can say this doesn't apply to everyone. Look at Swamiji, Namaskar Swamiji. How many hours he is sleeping? Look at our Indian Prime Minister. How many hours he is sleeping? But again, they are yogis. They are yogis. They are doing so many other things. But ordinary people like us, we need a good sleep. 6 to 7 hours, maybe 8 hours at, they say when you're getting old, like a child, you are reversed into childhood. You sleep for longer time. The sleep which is adequate for you is, the indication is, when you get up the next morning, you should be bright. You have full concentration, no fatigue, no sign of anxiety or irritability. That is a good sign that you had enough sleep. Look at the people. I will talk about now that our men, with the prostate problem, they are getting up in the night maybe 6 to 7 times. How much they must be having their problem with memory. But again, excuse me, so some of them have adjusted their life. They're still cheerful. They're doing everything. I really admire those men who are having prostate problem and sleep disturbance, and still they are so active the next day. So this is one of the reasons. Sleep apnea is also giving us loss of memory. How? Sleep apnea. When we have sleep apnea, our breath is not there, it is sort of closed for short time. So no blood is going to the brain. So it caused like mini stroke. No oxygen there, mini stroke. That's why sleep apnea is very, very dangerous condition. And please don't ignore if anyone is suffering from sleep apnea. Then other thing comes is our medicines. They are giving us this problem, memory loss. Many medicines are giving. Please panic about it and don't stop anything. Always consult your doctor. Even the medicine which we are taking for diabetes, metformin. Then we are taking the cholesterol lowering drugs like statin. And other one is your antidepressant.
Right.
Excuse me, we have to mute some of our friends. These are very, very common, and various other like drugs given for epilepsy, they are also causing all these problems. So medicines also the culprit, which is giving us this memory loss. Then come to people who have accident, head injury. We call it the memory loss, in medical term, amnesia. You see so many films, they show you, they lost his memory. He could not remember his own relative. This what happened in head injury. If there's no fully recovery of that injury, some part of the brain is damaged. And especially this part is important, the cortex, the outer layer. They are the points where the memory is coming from. Then coming to your thyroid problem. If your thyroid is not working properly, underactive thyroid, medical term is hypothyroidism. Those people are getting this memory loss, depression, increase in weight, they are putting on weight, loss of hair, and constipation also. So hypothyroidism is also cause of memory. Then too much alcohol take away your memory completely. That's why they drink, even some of people. When they're very depressed, they are unhappy, they go on having what they have, lots of pints of wine or beer, whatever. Then come another thing, our nutritional deficiency. Vitamin B12, which is very common in vegetarian. And as we grow older, vitamin B12 level goes down. So those people have to look after. Other thing is vitamin B1, known as thiamine. They are also good for our blood and nerve cells. So if there is deficiency, and then comes your cancer treatment. When we are diagnosed with cancer, we are so much upset, depressed, anxious, and very angry also. Why it happened to me? What I have done wrong? And then the therapy itself of cancer therapy, the radiotherapy, the chemotherapy, and the surgery, they can all lead to loss of memory, and then, stroke, paralysis. For any reason it has happened, whether this is your high blood pressure. So stroke can also, and especially in old people, they say the memory doesn't recover much. It lasts and lasts. And in the end, these people may be landed into dementia. Yes? Epilepsy also causes loss of memory because of its treatment plus the condition itself. Then the final stage is what we worry about today, dementia. This is the first sign of lost memory in dementia. That's why people are panicking about this when they're having loss of memory, whether I have got dementia or not dementia. So this is what all about it. There's so many reasons why there's a memory loss. But again, we can improve ourselves if we see our doctor early and get sorted out, because there are so many causes for this. We have to attack the cause of the problem. And that's what we are going to do today. Other thing is, you might ask, when should I see my doctor if I got loss of memory? Yes. When this happened too much in your life that you're forgetting things again and again and again, and that is disrupting your life even. Daily routine you can't do. You are going to be dependent on others. And other thing is, when we are talking now and you don't know what I am saying even. There's no attention. So you can't remember the conversation what Dr. Kapur has said. She said so much. What she has said, I can't remember anything. Anything. That is a dangerous sign. You can't remember everything because I covered quite a lot. If you remember some salient points, like important points are important. If you can't remember that, that means there is some problem. And if you think it is getting on worse, please see your doctor. Other thing is confusional stage. Sometimes we get confused. Simple example is you put your keys in your fridge. You put your keys in your fridge and you have gone to take a bath and you've taken off, maybe like I wear chain, put the chain there and don't remember to bring it back on me. Leave it there. Confused stage. Everything is confused. That is also serious. So please watch out. Don't panic. Always consult your doctor early so that he can help us. Now what to do? How to increase this? My brain skill, which is gone down completely. Don't only think about I am not sleeping much, this and that. There are other things also, which we can do to increase this mind power. First of all, keep very active. talk, very active. Do physical exercises. In that we can do, even if we have got mobility problem, we can do little bit walking slowly, sitting, doing some exercises, arms exercise, leg exercise, all the exercises, simple one. Go for a walk. And if you are very active, do jogging also, do dancing. All these are very, very important. That's what the dementia patients are having these clubs. Over there, even some of the clubs, I go and do singing there. Singing, dancing, laughter, yoga, and whatnot to make them happy and cheerful. So increase be active yourself. Do physical exercise, regular, every day. Then other thing is don't smoke, because damage the outer layer of the cortex where there is the memory centers are. Then other thing is healthy diet. Don't take too much saturated fat. Take lots of seeds and nuts, all the green vegetables. As we say, Mediterranean diet, all mixed carbohydrate, fat and protein, all this diet. And try to learn new techniques. Like we said, go and learn new language or new skill. Do this flower arrangement or card making. They all help us to increase our skill down there. Then maintain a healthy weight. If you are overweight, all the problems will come. Every problem will come. Then what we have to do, regular checkups with our GP. Make sure we are not suffering from hypertension or low blood pressure or the cholesterol level, or whether we are diabetic also. They can check all that. Have regular health checkups. And other thing which we say many times, start doing puzzles or other thing they do. Bingo, people go to bingo. You see so much crowd going for bingo. That activates your brain. Other thing is chat. Socialize yourself. Go for a cup of coffee outside and go on chatting with your friends. And then comes a laughter yoga. These are all going to help us. Now here we are talking about more our yoga pranayam. Yoga is the one which is going to increase the oxygen level in the whole body and even up to my brain. Even when we are chanting Om loudly, that is going up there because vibrations are going there also in the brain. So go on chanting Om or any mantra. Om Bhur-Bhava Swaha, whatever, Lord Krishna mantra, Mata Rani mantra, loudly, talk loudly. They say you can increase your memory loss by repeating. If you go on repeating, how we learn when we are in the schools, repeating, rehearsal, do rehearsal, repeating yourself, and the things get better. So these are the things. Now we are going to go into our routine practice of yoga. Now how the yoga is helping my brain. That is very, very interesting point. How this is helping. The yoga is going to increase my memory. They say when do you do yoga, then it will boost up my brain gray matter. As we are getting on old, our gray matter is diminishing. So it can increase our gray matter so that our memories increase. This take away our stress, anxiety, depression. Why we are doing yoga every day? If I am not getting better with my diabetes, at least I am much happier now. Yes? Getting rid of all the stress, anxiety, depression. And other thing is, it improves my mood also. Yes? I am more helpful. I want to do more and more. That you have developed after doing this yoga practice. And other thing is, it enhances your memory and focus. You can focus more because this is all is controlled from here. Eye contact is very important, but this one is the one where our memory is stored and we concentrate, we don't get confused. So these are the things. Other thing what we are doing every day in yoga practice is very simple. Super brain yoga, that is the one. This has come from India. They were not aware, the name is given here in super brain yoga. You know, when we get punishment, we murga bano. Chalo, can you highlight me? I see myself very small. Come on, stand up everybody. Do according to your own body. Don't overdo it. Hold it like this. And we are going down and bring your hips out. Hips are out. Breathe in, breathe out and go down. Pull your ears. Pull your ears. Stay there for a short time.
We can't
And
see
come up
you.
slowly.
We can't see you.
That's what I'm saying what to do. You
Put the
can't see
camera
me.
down. Camera.
No, it's highlighted. I think it's just because camera is the way she's doing sitting down, she can't
Yeah,
see her. That's all.
her camera is not adjusted.
Camera is just it.
You need to highlight. Yeah. No, not that way. That is self. You need to
Oh, it's coming
click
now.
it again.
It's too far down, you're looking at the carpet.
Oh,
I can see
now,
No,
she
we
feels-
are only
she
seeing
feels
the
it.
carpet
And
oh my
tablecloth
dear.
and your.
Now?
That's, I can see your face now. Just your face.
Now
nothing
you-
else.
Okay,
Now
Your
now
face,
it's
nothing
okay.
else.
You can see
No,
me,
no.
I can't see.
It's too high. You're too
go
high
the
up.
other way. Go the other way. Yeah,
That's better. That's it.
but
No,
you
I
see
can't see
more of
myself.
this.
I think in your side, Dr. Kapur, you have to highlight yourself. You have gone to different thing. That's me. You are spotlighted. I think you're okay, just your camera adjustment because when you're sitting down, they couldn't see you sitting down. That's all.
Now you can see me.
Yeah, yeah.
No.
Yeah, we can see you. Yes, I can see you.
But I can't get bigger, you know. Spotlight is not coming still. You can see me?
Yeah, you can see you. Just when you sit down, then they don't see you because your camera is up the way.
No,
That's better now. That's it. Okay, now.
but I can't see myself spotlighted, you know, that's the problem.
But where is the spotlight? But it's from your side, something you have to do.
Okay, carry
That's
on.
it. That's it.
Super brain yoga. You're holding your ears, both the side, that is going to activate my brain, the left and the right hemisphere. So my memory will be increased. Well done. The next, as we are standing, do the third asana, the mountain pose, simple standing, erect, standing erect. Very good. Then we do Tadasana according to Swamiji like this. Arms on the side, stretch here, take it up, hold it up, bring it down like this and up again, and stand on your forefoot. You get better concentration and various other benefits. increase the height in the children, good for constipation. Hold it like this, Tadasana. You are standing on your forefoot. Heels are up. Stretch whole body, whole body. Then release. The next one is jogging. There are so many steps where we are lower our heads, you know. So we will do those poses where we lower our head of the jogging. First one is Namaste Mudra. Go down. Then open up your arms like this. Namaste Mudra down, exhaling, coming up. Hold it. Up. Again. Up. Again. The next one is a Konasana. We are touching the opposite feet, but the head is down towards the ground, not up. 1, 2, 3, 4, 5, 6. Head is down. Head is down. Recon, the head goes up. The next one, the head goes up. So we are not going to do that. Carry on. Other benefit, you will be losing weight and activating the whole body. Increasing the circulation in the brain. Carry on. Well done. Next one is Padhasana. Join your feet. Take the arm from the side. Stretch. Up again. Stretch. Then take the arms down, head down. We are going to touch our feet. If you can, if you can't, take your head down and touch any part of your lower limb, the thighs, the knees, the leg, or your toes. This is very good asana for increasing our memory, increasing the circulation of blood in the brain. Stay there for a short time. Go on chanting inside. Om Namah Bhagavate Vasudevaya. Om Namah Bhagavate Vasudevaya. Om Namah Bhagavate Vasudevaya. Then breathe in. Slowly come up. Stretch. Stretch. Then breathe out. Slowly go down at your own pace. Enjoy every step. Every step. Try to bring your nose close to your knees if you can. So the head is pretty low. And come up slowly. Stretch and from the side. Slowly. Yes. Now the exercises what we do for our nitric oxide, they're all going to help me. Why? Because the nitric oxide is stored on the lining of the blood vessels. So the blood vessels are open up. Once the blood vessels are open up in the whole body, the same will happen in the brain. They will be opening up and more blood flow is going there. So we'll do just short time those physical exercises for the nitric oxide. 1, hips are out completely. Idea is to increase the circulation. So this is good for my brain also, these exercises. This is number 1. Number 2, we do like this. Try to put your head down. Don't look up, put it head down. Target is our brain today. The next one. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. That's enough. Next one. 1. I am putting my head down. Head down. Very good. We are increasing the nitric oxide, dilating my blood vessels. Next, do roping also. Stretch your arms and go roping, backward and forward. So these one we have done, the exercise for the nitric oxide. Very good. Very good. Carry on. Well done. Just relax now. Get more energy from the nature. Breathe out. Then breathe out. Breathe in. Go up very slowly. Ask the nature to give me more power, my pran shakti. Breathe in. Then breathe out. Well done. The next one, so many poses you can do while sitting. The sitting you will be doing your Paschimottanasana. That is very good for the increasing flow of blood in my brain. Sit down first in Dandasana. Dandasana is sitting state. Sitting state. Hands are at the level of your hips. Sitting state, spine state. And look straight. Bend your right knee. And take your arm by the side. Breathe in. Breathe out. Go towards your left foot. Any part of your lower limb of left. Your thigh, your knees, or your toes. And put your head down. Stay there for short time. Then relax. Now the other leg now. The left knee is bent. Right one is stretched out. Take arms from the side. Go down slowly while exhaling from the nostril. Try to touch your lower limb, any part depending upon your stamina. I am touching my toes. My head is down. Nose is going very close to my knees. Stay there for a short time. Do your mantra japa. Tap and jap. Tap is pranayama exercises and the japa is mantra chanting. Then release. Breathe in. Now do both the side. If you can do now, legs are stretched out. Breathe in from the side, up arms, coming up, stretch again, stretch. Then take your head down. My hands are going to touch my toes. And the head is quite down. Nose is going quite close to the knees. Stay there for a short time. Then relax. Now you can lie down. We'll do some more poses. Lie down. There's so many poses you can do. I will just cover a few. Okay? Lie down. Just relax. Just relax. Relax your body and the mind. Now here the idea is the head should go down. So many poses you can do. First right leg up and up 90 degree. Yes. Then other one also up. I am doing verification of your Sarvanasana. I call it shoulder stand. I can't do fully, but you can just imagine. The legs are going more towards over my head and whole body weight is on the shoulder. Sarvanasana. Okay. You can do that if your body allows you. Other one is Halarasana. Again, the legs are going up. Right down. The feet are touching the ground. The toes are on the ground. Hands are in front. We do only half Halarasana as we did before. This is the one which is going to help take your legs right down over the head. Well done. The next one is which is very easy to do. Your Setubandhasana. You're lifting your spine up. Spine up. Setubandhasana. Do this. Stay in this position for a long time. Very good. Take it down. The next one, you do your Pavan Muktasana. You are moving your head backward and forward. See? We are going to do both together. Come on. See? Head is going down. Head is going down in front. Idea is to increase the circulation. Well done. Relax now. Now relax. We are going to sit down now. While sitting, there are certain asana, which is great help to the brain circulation. The first one is your Sukhasana. Sit in Sukhasana because that control your mind also. Just sit in Sukhasana. That is you're crossing your legs. So easy. Sukhasana. And just go on doing your chanting. Keep your hand in Dhyan Mudra. That is going to increase the circulation of blood in my mind, my brain, increase my memory, concentration, the Gyan Mudra. This is one asana. Second one is if you can do Padamasana, where you take your feet opposite side. That is known as Padam Asana. That is also very good for the increasing your memory. These are a sitting asana which you can do. Who can do Padam Asana? I think Lilo can do it, I think. Put one foot over near the groin of the opposite side and other one on the opposite side groin. That is your Padamasana. That is very helpful. If you can't do it, don't stretch yourself. We are doing more than enough for our age. More than enough. Very good. Sit in Padamasana. The next we are going to do some steps of pranayam now, which is going to help us. We'll be doing with various mudras, because most of the mudras we are doing going to increase the circulation of blood in my brain. So let's start our pranayam. The protocol covers everything actually. Only you have to pick up certain things which is more applicable for that political topics we are covering. So we are sitting, relax ourselves, keeping in mind all the precautions of pranayam, as I mentioned, coming to Kapalbhati, any headache, any dizziness, vertigo, bleeding from anywhere, don't do it. After major surgery, 4 to 6 months, and even after minor surgery, you consult your physician or yoga teacher which one to do it, how long to do it. If you're pregnant or trying to get pregnant, don't do it. These precautions are very important. Otherwise, Kapalbhati is the best pranayam, king of pranayam. It is also going to increase the circulation of blood in my brain. So we will start with the first mudra, this one, Jnana Mudra. 1 stroke, 1 second, the full attention is on exhaling. Automatically we are breathing in. Lift up your spine. Lovely smell on the face. I am going to increase the circulation in my brain. So my full attention is on my brain now. At your own pace, don't do fast, slow or medium. So many mudras you can do. Whatever we do, there are multiple benefits. One motion and multiple benefits. This gestures, mudra is hand gesture, shaping your hand. To get the medicine from your hand, everything is here in the body. Only we have to learn how to take it. Carry on with a smile. I can see you. Lift up your spine. Next was the Pran Mudra. That is going to increase the pran throughout my body, up to my brain, and going to help me for the loss of vision also. Increase my vision. Take a mild double vision. Any problem with my vision or with my eyes. Pran mudra. Carry on with the pran mudra. Pran. Pran apan vyam udan. 5 prans and 5 assisted prans. Pran. What is pran? My guru, my mata, my pita, my brother, my sister, my teacher, and my close friend. Pran, pran, pran shakti. And Lord is called Pran Nath because pran is under his control. Pran Nath. Ishwar. Next, move over to your chin mudra. Upside down the Gyan mudra. This is also very good. And this will help me for my sleep problem also. That is one of the cause to get loss of memory. Can't sleep at all, or sleep, get disturbed sleep, get bad dreams also. Chin mudra. That is going to help me. Go on doing Kapal Bhakti. You are doing very well. Carry on. Memory is getting better every second. Next is your Vayu Mudra. The tip of the end is touching the base of the thumb. Thumb is resting. Vayu. We are controlling of Vayu. If there is no Vayu, naturally the blood won't be flowing then. Increase the Vayu Mudra. Carry on. Most of the problems are because of the Vata problem. 3 dosha in the body, Kaph, Vata and Pitta. The Vayu is the one which is, Vata is the problem in our body, giving us so many problems, especially in this golden age. Look at the arthritis, look at the indigestion, digestive system not working. Jata Agni is going down and down and down. Same with the brain. At your own pace, carry on with a smile. Next is Apan Vayu Mudra. Apan Mudra and the Vayu Mudra, double Mudra. This is very good. Apan Vayu Mudra for the brain and various other problems like breathlessness, for the heart. And it's lower the blood pressure also. So many benefits. Well done. Carry on. Next is your Kamal Mudra, Lotus Mudra. How to do it? First do Namaste Mudra. This is also very good. To increase the circulation in the brain, we are respecting each other. This gesture. We are loving each other, respecting each other. Heart to heart. और प्रणाम कर रहे हैं उस सर्वशक्तिमान को जो सबके अंदर है, उस प्रभु को प्रणाम कर रहे हैं. नमस्ते मुद्रा इज वेरी गुड. Next is the lotus mudra. Open up your fingers. Keep touching your little finger and the thumb. This is your lotus kamal. This is also very good for increasing the circulation, and other thing is very good for the urinary problems also. If you are suffering with recurrent urinary tract infection again and again, do this mudra. This will help you. Do Kapal Bharti with Kamal Mudra, Padam Mudra. Simple, simple. Kamal. Next one is your Prithvi Mudra. This balances our mind also. Give us more tolerance like earth. भूमि माता की तरह हमें टॉलरेंस सिखाती है ये. जब माइंड में टॉलरेंस आएगी तो सर्कुलेशन बढ़ेगा नेचुरली. गुस्से में क्या होता है, उल्टा इफेक्ट होता है. इसमें टॉलरेंस बढ़ रही है और हमारा वेट भी कंट्रोल हो रहा है. गेटिंग रिड ऑफ ओवरवेट. Go on doing Prithvi Mudra. Well done. I will add one more today, new for you. Agni Shakti Mudra. To take away my Agni, my anger. I am just diagnosed as a diabetic person and I'm so annoyed, so angry. Why it happens to me? I am so careful. What else I could have done? Agni Mudra, very simple. Bend your knees at the shoulder level. Close your all fingers and touch the tip of your thumb. Agni Shakti Mudra. And do Kapal Bharti with this. Very simple. Close all the fingers like making a fist. Thumb is out, touching the tip of the thumb. The elbows are bent at the shoulder level. Agni Shakti Mudra. Take away all my Agni, anger. When I am calm and quiet, de-stress, it increases the circulation of blood in my brain. So we have done a lot of mudra. You can do many more actually. Let's move over to now pranayam of our Anulom Vilom. That is very, very important to increase the circulation in whole body. Plus in that you will be doing few times Anulom Vilom, then we will be doing Nadi Shodhan as I've done last week. So change over to Nadi Shodhan. Please practice that for a long time if you want to get better with your memory loss. So we'll start. To get rid of short-term or long-term memory loss. Even if you reach the stage of dementia, this will help us. Not to get stroke, not to get any central nervous system problems like Parkinson. With all diseases, people are having memory loss. Whatever disease you're suffering, your diabetes, Parkinsonism, motor neuron disease, Crohn's disease, any autoimmune diseases, they're all related with the memory loss. So please try to do it alone for a long time. This will take away my anger, my greed, my gussa, the competition, ego. This is going to open up all the channels in the body, all the channels, the blood vessels and the nerves also. Carry on. Take your mind to your brain. Now change over to Nadi Shodhan. The difference is, when we do Alom Vilom, there is slight sound. Nadi Shodhan is the clearance of all the nadis, and that is soundless. And we hold our breath. After inhaling, we hold at our own capacity. Please don't hold your breath if you are suffering from severe hypertension or heart problem or any breathlessness. So you have to watch your own body. We hold the breath and then we exhale from the other nostril as we do in Anulom Vilom. So we go on changing, only holding. And if you hold for a long time, you get extra benefit because more oxygen is going to the body. More we do, we get more benefit. जितना घी डालते हैं मजा आता है ना, जितनी शक्कर डालते हैं तो अच्छी लगती है। इसी तरह ये बॉडी का हाल है, योग करते हुए जितना लंबा करेंगे उतना फायदा होगा। So let's start with नाड़ी शोधन। जो कर सकते हैं प्लीज जरूर करो। अगर किसी को नहीं पता तो you can WhatsApp me, we can do it again 1-to-1, no problem. Okay, let's start now. Close your right nostril with the right thumb. Breathe in slowly without producing any sound from the left nostril. You can breathe 2.5 seconds, 5 seconds, depending upon your stamina, maybe 7 seconds. Then you hold your breath. How long to hold depends upon your practice and stamina. Holding, very good. Can't hold anymore. Then close the left nostril with these two fingers, the middle is the ring. Gentle pressure on the left nostril, exhaling from the right. And try to exhale fully, maybe a little bit longer than inhaling, so that you throw out the carbon dioxide. Then breathe in again from the right. Slowly in, slowly go on breathing. Then hold. Can't hold anymore, and close the right nostril, exhale from the left. This is one cycle of your Nadi Shodhan, clearing up all the nadis. Very effective for all the autoimmune diseases, increasing the circulation in the brain, not to get memory loss. Well done. The next is, here we can do humming again to increase more nitric oxide, to dilate my blood vessels. That is also for the brain also, and rest of the body. So we do humming. You get lot of benefit by doing humming like this, to increase our immunity also. And you can do next your Bhamri Pranayam. There are other benefits also. Increasing the circulation in the brain, because we are increasing quite a part of nitric oxide also by doing humming like in Bhamri. Plus it cools our mind completely. We want to de-stress ourselves, take away all our anxiety. Good for hypertension, good for heart problem, good for menopausal problems. So we'll do 3 times Bhamri Pranayam. Next, Udgit Pranayam. We do 3 times Om chanting loud. Om the 8th step known as Prana Pranayam. We are in the seat of silent meditation, or we can do loud also today. Fix your mind either on your breath or the third eye, the Agya Chakra. Go on chanting. We'll do a little bit loud today at 3 tones. Shivoham, Shivoham. First, we are doing quietly inside, jap inside. Then we'll be whispering, and then we'll be doing at 3 tones, slow, medium, and high pitch. Shivoham. Shivo, 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 Shivoham, 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 Shivoham. Say inside, ever, I am never alone. I am never alone. The supreme power is always with me. He shows us the path, how to serve the humanity. We are very thankful. Very lovely session on memory loss today. With all my lovely friends on the Zoom, thank you very much, Lord. Thank you. Thank you. Thank you. Raise your arms up. Rub your palms. Put the palm on your eyes. Slowly open your eyes and move back. Om Shanti. Well done. Okay, before I do the last prayer, I would like to say there's some more asana if your body allows you. You can do like headstand, Shirshasana. I think I can't do all that, but I can mention that if you can do it. Please, if you are over the age of 40, don't do it. Okay? Even one of our friend who was doing yoga practice for a long time, he did it. And I'm sorry we lost him. So be very careful what you're doing. Always consult your doctor before doing anything new, even in the yoga practice also. And the other thing is which we do every day, Surya Namaskar. There are so many steps where we lower our head, isn't it? Time permit, yes, it does. We can do now. Surya Namaskar, come on. सूर्य भगवान दर्शन दे रहे हैं बड़ी अच्छी तरह मेरे कमरे में. सूर्य भगवान की जय. 1 Namaste Mudra, Anjali Mudra in front of my chest. We can all do standing or sitting according to your own body. And keep in mind all the precautions. No jerky movements. 1, 2, 3. See, we are going down. This is our Chashakasana. Come on, baby pose. Look down, right down, near to your feet. Your hands are. And breathe in. Go up. Stretch again.
Okay.
Then, sorry, yeah, I did wrong. 1, 2, 3, 4. We are touching the coming the right leg coming up. First, Bhujangasana, looking up at the ceiling. Then look down. Leg is going down. Arm is going up. This is your 6. The 7 is going down again. Hold it, your left knee up close to your chest. And looking up the Bhujangasana. And nose down close to your knee. 9 and 10 down. 11 up again. Stretch. And then Namaste Mudra. Yes. 1, 2, 3. Left leg now coming up. 4. Up, neck up. Then down. Take it down. Up. Then down again. Hold your right leg up close to the chest. Looking at the ceiling. Then head down. Coming down. 10, 11, and 12. So these are the poses where the head is going down are the important one. So that's what I said, whatever we do, whatever condition we talk, do the asana related to that so that you increase your, today we have increased our circulation of the brain by doing various poses. Now, the thing is, before we close, I would like to ask some people now, what problems you had that you were concerned about your memory loss? One by one.
Dr. Kapurji, I requested you to do this session. And my problem is I'm very forgetful. I forget names. If I want to call my daughter, Chrissy, I call so many other names before I call her. And then the second thing is, I'm forgetful where I put the things, like you said, the keys in the fridge. I put my notepad or my phone in the fridge, things like that. And third thing is, if I'm talking to you and I want to say something, and within a second, I forget what I was going to tell you. So that's my problem.
So have you been to the memory clinic?
No.
please go. Ask your doctor. Go and
Okay.
tell him all these symptoms you have told me. And
Okay.
he will send you to a special clinic known as memory clinic. They do
Right.
intensive assessment and then
Okay.
they guide you. Maybe the simple techniques might help you.
Because my father was,
Sometimes we are doing too many things together. The
yeah,
mind is clogged up already with all that
my mind is
rubbish
very,
there, and then we don't. Other
My-
thing is our time management is very important.
my
We don't do our time management. When you don't do that, you get confused. So this is very, very important. Stress management, time management, relaxation therapy, and cognitive therapy, which is given by the specialist. So
Right.
please don't ignore yourself.
Thank you
Ask
very
your
much.
doctor to send you to memory clinic. They can't do it.
Thank
It's
you.
a specialist clinic. Anybody else has got any problem?
Minaji.
Yeah, I keep forgetting names, and sometimes, it's short-term memory. When I know what I want to say, but the phrases or the sentence doesn't come out. Like I was thinking about this, our Chancellor Kazi, and he came on, Ellen Sugar's show, and I just couldn't think. I could picture which show he came. But then it came, but it's like that, and I'm worried that why am I forgetting and phrases are not coming. But doing all these exercises makes me feel that my brain is quite, oxygenated, which feels good.
Anybody else, please?
Same, Dr. Kapur, I forget as well, but after a little while, I remember it. I'm going to the fridge, and I don't know why I was going to the fridge or something like that. I'm going to be 73 in December. So I think it's part of growing old. It's not as extreme, but I do put things away and then I forget where I put it. That takes me ages to find it.
Very similar to mine.
Same
Yes.
here.
Yes, that's what I'm saying. It's like old age, I put it down to old age. Because I asked the doctors and they said, no, you've got no memory problem. That's what happens when you get old.
Can I add something here? Dr.
Yes,
Kapur?
please.
I have the same thing as well. So doesn't matter. I don't have dementia. It's just part of my aging process.
Yes.
Sometimes I want to say something and I forget. Then I have to think, then come
that's
back again.
true.
It's just like
Same happened
gap
here.
in
Yeah.
there's a bit of gap in because your aging process, your body degenerating. So that's not dementia. That's just part of our aging process. But how you manage it, like doing yoga every day, will help you to sustain it longer. That's all I can say. Swami has given us all the technique. We have to do it
The
daily.
tools, yeah.
रोज करना पड़ेगा एक दिन करने से नहीं होता रोज करना पड़ेगा because आज जो डॉक्टर कपूर ने किया हम लोग जो करते हैं रोज करते हैं it's a similar thing. So we're trying to prevent not just the memory loss, preventing joint pain and everything else. It's like a overall over-tuning your body, so everything becomes good.
I would
Thank you.
like to do more of eye exercise as well, because my eyes are getting weaker
That's
as
right.
well.
That's good.
Thank
Only
you
thing is,
for doing this session for us. Very interesting.
it
was
is
very
very
good.
It is very common.
It's
But
helpful.
again, as I mentioned before, if it is happening more often, you can't do
Then,
any
yeah.
conversation with anyone. You are isolating yourself. You are going in the stage of depression, anxiety.
Yes.
So please consult your physician. Don't ignore. Go and get the help. If you go early, you will be treated, because otherwise, what is happening in our mind? Oh, she's having dementia. Oh, she's having dementia. It's not dementia, So you are in that fear of dementia because there's so much talk, so many charities for dementia, Alzheimer, this and that. And there's not one type of dementia. There's 165 types of dementia. So that's why please don't just sit quietly. Consult your physician And if it is getting worse, don't sleep on it. Go and ask the help. Help is available. Other thing we say, when we are talking, I told you that day I'm going to theater. And after 2 days again, she asked me, which day we are going to theater? Are we going for a cup of coffee to our local cafe? She doesn't remember. And when they go on asking again and again, repeating, that gets quite annoyed for the person. So that's why I think to have good life, socialize yourself, don't ignore yourself. And the easy way, you do yoga practice every day. Nothing else is required. Nothing else. Laughter yoga, simple protocol of Swami Ramdev Ji Maharaj. Anybody can do it. And we are very lucky we are having classes every day on the Zoom.
Yeah,
the credit goes
very
to our
lucky.
friend Shravan
Yeah.
ji.
Very lucky.
Very lucky.
We are very, very lucky. Most of the Zoom sessions are now stopped
Yes,
because
we are.
we are going to the centers now. We are going to the centers, but we are here very lucky. And I'm very grateful to Shravan ji and pray to Mata Rani, give him more strength, healthy, happy, cheerful life.
Thank you, Dr. Kapur. That was excellent.
डॉक्टर कपूर, मुझे भी कुछ
Thank
पूछना है
you.
हिंदी में।
हाँ जी,
हिंदी में पूछना है मुझे।
जरूर हिंदी में पूछिए।
आप समझ जाएंगे ना, नहीं तो वो मेरी
अरे, हिंदी
भाभी है
मुझे
ना,
आती
कंचन
है।
भाभी, वो आपको एक्सप्लेन करेगी।
नहीं
मुझे
पूछो।
ना पहले ऐसा स्ट्रोक आया था,
हाँ जी,
मिनी स्ट्रोक बोलते हैं ना, तो
हाँ
हम
जी, हाँ जी, मिनी
डॉक्टर के
स्ट्रोक।
पास गए, सब कुछ किया, उसने स्कैन भी किया, लेकिन बोलते कोई ट्रीटमेंट नहीं है तेरा। तो मैं चाहती हूँ कि मैं कौन सा योगा में करूँ तो मेरे को राहत मिल जाए।
जो मैंने आपको बताया सब करो, ज्यादा करो। भस्त्रिका प्राणायाम, ब्रीदिंग इन एंड आउट, कपाल भाती भी करना है और ज्यादा टाइम स्पेंड करना है अनुलोम विलोम एंड नाड़ी शोधन। उसके ऊपर करो, आधा घंटा घंटा लगे रहो। मैं आपको बताऊं, मेरे क्लास में एक लड़की आती थी, उसको वो था स्ट्रोक, बट शी वाज रेगुलरली डूइंग योग प्रैक्टिस फॉर द लास्ट मेनी इयर्स। शी रिकवर्ड हरसेल्फ इन 7 days। तो प्लीज करिए अनुलोम विलोम, नाड़ी शोधन, लंबा टाइम करिए। और वो किया ना सुपर ब्रेन योगा, करो।
लेकिन
और यहाँ मारो ताली
डॉक्टर कपूर, मेरा
सिर
जो
के
ये
ऊपर।
सिर है ना, हिलता रहता है ऐसे।
सिर हिलता है और हाथ भी हिलते हैं, आपके।
नहीं, खाली सिर ही ऐसे ऐसे होता है।
कैसे होता है? ऐसे होता है?
ऐसे
कैसे होता
ऐसे नहीं, खाली ऐसे ऐसे।
है? हाँ, तो
जब
फिर इसके लिए
भगवान को
डॉक्टर
प्रे
को
करते हैं
कंसल्ट
ना,
करो।
तभी ज्यादा हिलता है।
नहीं बाबू, देखिए, डरना नहीं, इग्नोर नहीं करना इसको। आप डॉक्टर के पास जाओ, क्योंकि देयर आर सर्टन, ये जो ब्रेन की बीमारी है ना, सेंट्रल नर्वस सिस्टम जिसे हम कहते हैं, वो उसके लिए वो इन्वेस्टिगेट करेगा आपको।
लेकिन डॉक्टर कुछ करते नहीं है डॉक्टर कपूर, वो बोलते हैं कि बस कुछ नहीं करना है, इसकी कोई ट्रीटमेंट ही नहीं है।
तो आप एंग्शियस रहती हो,
बहुत
रहती हो,
बहुत रहती है।
आप स्ट्रेस रहती हो, ज्यादा
बहुत रहती है,
वरी रहती है ना इसकी। तो अब वरी को दूर करना है, उसके लिए डिट्रैक्ट करिए, मेडिटेशन
भाभी है
करिए,
ना,
जोर से
बताओ
गाओ,
तो।
भजन गाओ, खूब जोर से भजन गाओ।
वो रंबा भी वो
उसको फिर अगर देखो ना, अगर डॉक्टर कहता है कुछ नहीं, उसके पास आपकी सारी स्टोरी है, आपके इन्वेस्टिगेशन है, मुझे तो पता नहीं ना।
वो मेरी
तो
भाभी
बाकी
है
ये
ना,
है कि
आपको बता
हमने
रही है।
पैनिक नहीं होना इस टॉक से आज।
मैं डर
और
जाती
अपने
है
आप को
डॉक्टर
इग्नोर
कपूर,
भी नहीं
मैं
करना।
डर जाती हूँ।
Why you રણભાબેન કેનાથી બીવાનું હોય આપણે? આ એક જ લાઈફ છે, હસો બોલો, મજા કરો, that's all. કોઈ બી વળી
દાદી બહુ જ કરે, બહુ જ વારી કરે।
कई चीजें ऐसी हैं,
તેની વસ્તી વળી
उनके
કરો।
साथ कहते हैं हंसना सीख लो।
હા, બધા
ये
સાથે જાઓ।
झूरियां पड़ रही है कि नहीं झूल रही है? आंखों की विजन भी
रंभा
जा
भी-
रही है, सुनना बंद हो रहा है। तो ये तो
रंभा-
ओल्ड एज में कुछ तो प्रॉब्लम होनी है, पर अगर आप योग करोगे तो आपका जीवन अच्छा रहेगा। तकलीफ तो है, पर जीवन अच्छा होगा। तो
करते हैं
जिनमें
अभी।
श्वास हैं वो बेटर होंगे। अगर हम योग नहीं करेंगे तो फिर एक कोने में बैठ जाएंगे, कोई मैं पूछेगा नहीं,
वो
You will
मेरी
be in state of
मेरी
depression.
भाभी and श्रवण जी
योग
का
करो,
हाल।
योग करो, योग करो.
Happy, keep moving.
Yeah. Dr. Kapur, you know, can I ask you something just very quick?
Yes, Leela ji.
हाँ जी,
बोलिए.
हाँ जी.
Yeah. You know, with the Nadi Shodhan, when you breathe in, if instead of holding, if you just close both the nostrils, is this the same effect? And then take
No,
it
no,
out.
no, no, no. ये
No?
टेक्निक नहीं शुरू करना अपना.
So that when you hold the two, it stays inside the breath.
Close your right nostril.
Yeah.
Breathe in from the left.
Yeah.
You can hold your breath or you can't hold. Tell me.
No, but instead of holding, can you just close both and
Hold
then
means you are not breathing anymore. You are stopping the breath. Pause.
I see.
Pause
Okay.
कहते हैं pause.
Got it now.
हाँ,
Yeah.
pause करना है. बाकी
Yes.
ऐसे होल्ड करनी है. अगर आपको नहीं होता तो आप ऐसे कर सकती हो. इसको बंद करके, पर क्लोज टेक्निक प्रॉपर नहीं होगा. तो इसलिए होल्ड का मतलब है pause.
Yeah, I got it now.
उसे कहते हैं
Yeah.
कुंभक.
Thank you so much.
संस्कृत में ये
Kumbhak.
कुंभक. Breathing in your पूर्वक,
Yes.
breathing out your रेचक, and this is your कुंभक. तो हम कुंभक कर रहे हैं, कुंभक.
Yeah.
डॉक्टर कपूर, इसमें ये चीज है ना, हम नाड़ी शोधन जल्दी कराते नहीं है क्योंकि most people at our age have a high blood pressure. जब ब्लड को होल्ड करते हैं तो ब्लड प्रेशर बढ़ने का चांस बढ़ जाता है. थोड़ा केयरफुल होना पड़ेगा. मतलब I'm just warning them.
इसीलिए मैं हमेशा प्रिकॉशन बोलती हूँ. हाइपरटेंसिव, जिनको ब्रेथ की प्रॉब्लम है या हार्ट की प्रॉब्लम है, प्लीज डोंट डू इट विद द प्रिकॉशन.
इसलिए नाड़ी
हर
शोधन
एक चीज
कराते
सबके लिए
नहीं है.
सूटेबल नहीं होती, बट इट इज आवर ड्यूटी टू टेल यू प्रिकॉशन साइड बाय साइड.
That's why Anlom Bilom is the best way. Just do Anlom Bilom that at the same time. That's the point, you know. Just
Don't hold you.
You have to do it for 10 to 15 minutes to get the maximum benefit.
करना चाहिए लंबा टाइम इसको. ये हमारे लिए बेस्ट है प्राणायाम. अनुलोम विलोम.
That's the last 2 years I've been focusing more on pranayam than rather than asana, because even for community.
चलो नेक्स्ट वीक मेरा सेशन होगा सिर्फ प्राणायाम के ऊपर विद भजन बैकग्राउंड. देखो फिर कितना आनंद आएगा. सारे ऊपर कौन जाओगे.
आनंद है.
भजन ही भजन एंड प्राणायाम, नथिंग एल्स.
Good.
Thank you.
नहीं, next topic is for you. How many people are suffering from varicose veins? पता ना, थ्रेड वेन्स ब्लू
I've got
ब्लू
little
होती हैं,
bit.
स्पाइडर की तरह.
हाँ. एक में है.
How many are suffering? Just I got a bit here only.
Only on one
On
leg
the
where I had it removed. About 35 years I had it removed. ने अभी आ गए हैं वापस थोड़े.
कितने लोगों को है वेरिकोस वेन?
देखो ऐसे पाँव में इतने बड़े.
अरे हाथ खड़ा करो अगर हैं तो. नहीं है तो you are very lucky.
Okay. Now I want to ask you something. I've got a hernia, hiatus hernia. मेरी large bowel निकाली थी, उसमें स्वोत्सोमा था. फिर मैंने hernia का ऑपरेशन कराया, मैश डाली थी. अभी सब ऊपर आ गया है, ऊपर like above my navel, going towards my breast. So I can't bend down क्योंकि bend करूँ तो वो pressure आता ना.
हाँ जी, ये हमने
So I
टॉपिक
keep
कवर
doing.
किया twice.
But I've not probably.
Reflex has been covered
Probably
two
I've not
times
been
already.
I've not been here all the time. श्रवण जी ने हाथ में points
Bend
दिखाए थे.
backward.
Okay, पीछे.
Don't go backward.
Don't go backward.
हाँ, back नहीं जाना. यही precaution है इसकी.
Okay.
Forward
I don't go
you can
back.
go क्योंकि नीचे जाएगा. जब forward करोगी तो नीचे जाएगा. Back जाओगे तो ऊपर आएगा, towards the esophagus in your chest.
But forward, forward जाती हूँ तो.
Don't bend backward if there is a hernia, simple hernia, or hiatus hernia, or acid reflux.
Okay. लेकिन bend if I bend down, it hurts. If I bend down, it hurts. Pressure आता ना.
देखो अपनी body है ना आपकी. Every body is different. अगर आपको forward झुकने में है problem, please नहीं झुकिए, सीधा बैठिए.
I do.
ये
but
body
sometimes.
बड़ी important है.
No.
That is known as yoga practice is what? Tailor according to yourself.
Yes, exactly.
कपड़े
That's what I do.
बनवाते हैं ना, तो टेलर के पास जाते हैं अपना साइज. इसी तरह
हाँ.
योग प्रैक्टिस में
Yeah.
you tailor according to your physical, mental conditions.
Yeah,
क्लास
no,
तो
that's what
चलेगी
I'm
क्योंकि
doing.
क्लास
हाँ.
चल रही है, पर
हाँ, no,
आपने
that's-
वही करना है जो आपके लिए
सूट होता है.
harmful नहीं है,
No,
जिसमें
that's
आपको
what I'm
फायदा
doing.
है.
हाँ. That's what I'm doing, but I thought I'll ask you, being a professional.
ना बी वेरी, बट जो हमारी टीचिंग है